And the American Health Care Act narrowly passed a vote in the House. Well, today, millions of people with pre-existing conditions wonder what will become of their health care.
Allison Levine introduces us to some of those concerns. Allison.
Kim Calvin, under the Affordable Care Act, insurers aren't allowed to deny coverage to people with pre-existing conditions. With this new bill, Republicans insist that people with those pre-existing conditions can rest easy. For some, that's easier said than done. What Dina Duncan sees as a tragedy.
It's devastating. I mean, it's really devastating.
Representative Chuck Fleischman boasts a victory.
Yesterday in the United States House of Representatives, we passed the phase 1 of the beginning of repeal and replace of Obamacare.
The American Health Care Act now on its way to the Senate. A concerning series of events for Dina for one reason.
My children with pre-existing conditions are not safe.
Dina's kids have asthma, a pre-existing condition. They're also genetically predisposed to what Dina's doctor found 3 years ago.
I went for a routine mammogram and they found 5 millimeter, just a teeny tiny spot on my mammogram.
Cancer. For 3 years, every 3 weeks, another round of chemo.
Chemotherapy can cost $30,000 a treatment.
Thanks to the Affordable Care Act, Dina isn't paying anywhere near that.
I was delighted to pay $1,400 a month and continue to be delighted to pay about that much for myself and my family.
But others aren't.
A lot of healthy people are mad about their premiums being high, and a lot of healthy people don't think that what happened to me could happen to them.
And if it does?
People like me wouldn't be, looking at losing everything that they've ever worked for.
But Republicans say that's not the case.
We've put money in the bill to make sure that those with pre-existing conditions will be covered.
And they'll have huge deductibles and they'll have huge premiums.
Which could happen to her own kids.
If the Affordable Care Act is repealed, a lot of reports say that my children would have over $100,000 deductible.
Republicans plan to set up what they call high-risk pools for people with prior health problems. The bill offers $138 billion over 10 years to help pay for people in those pools. Kim?
Allison, thank you. As the bill stands right now, insurers can raise premiums on people with pre-existing conditions only if they let their coverage lapse for more than 63 days.